This is a 41-year-old female who came in with long-standing history of pain in both knees that has now taken up to 2 years. So she has been using some analgesics that could help, but then when the drugs wear off, the pain relapses. On examination, she had tenderness on the lateral aspect of the right knee. With a reduced range of motion, she couldn't flex fully that right knee, because she could also complain that squatting is a problem, especially when she goes to the washrooms. But the joint wasn't swollen, it wasn't reddened, and there was no temperature gradient. So what's clear here is that we are having arthritis. Arthritis, which is literally inflammation within a joint. Remember, any mobile joint is a point where bones can meet for flexibility purposes. So you'll have bones joining, but they will have a gap in between them to allow mobility, especially in those movable joints. So in that gap where the two bones meet, you need to have a cushion and a structure that will allow lubrication. So when you have inflammation involving either that structure that allows lubrication or the structure that does the cushion, that's the cartilage per se, then the other one of lubrication is the synovium, you'll come up with arthritis, which has very many types, and the cause of the arthritis dictates which type it is. So we may have rheumatoid, gout, osteoarthritis, the psoriatic, juvenile, hemophilic, septic, name them, very many. So, but today we shall only concentrate on osteoarthritis. To start with, in this X-ray, we have features of osteoarthritis, which are cardinal. The right knee is on your left, and the left knee is on your right, so they are interchanged. So we have one, a decreased intra-articular space. Remember, our knee is a weight-bearing joint. So you are having inflammation within the structures that make the articular surface, that is the cartilage and the synovium. So these structures are inflamed and you are continuously putting weight on them. So you will erode them away. When you continuously put weight on the eroded surface, of course that surface will reduce. Then two, now we have osteophytes. Osteophytes are these structures that look like outgrowths at the bone edges, especially just adjacent to the articular surface at the bone edges there. So they are just areas of ossification after continuous inflammation. So you are having inflammation today, tomorrow, because you are eroding the cartilage, or you are continuously injuring a narrowed joint surface. So you have inflammation where minerals will be deposited and it ossifies. That's why the outgrowths come. Then thirdly is some bit of deformity. If you look in the or at the lateral right knee on your left, on the lateral aspect, you will see a bit of can I say deformity? That tibial plateau is kind of deformed because of the continuous weight that is felt from up. The other feature here still is sclerosis, more in the right knee still, on the lateral aspect, which are areas of hypermineralization, because they want, like the body wants to make this side more stronger as it is feeling more weight directly. So that's why it is appearing a little brighter because of more mineralization. So it is feeling that weight directly from up the limbs being felt on that tibial plateau area. So osteoarthritis, literally, which is also known as a wear and tear arthritis, we just have an erosion of that cartilage, which is a cushion between the two mobile bones. So after the cushion has gone, you'll have, of course, the two hard surfaces of the bone rubbing over each other. You injure the cellular structures that are around there, then you inflame. And that's why the patient will, first of all, feel those features of inflammation, and they will present with them the pain. Sometimes they can be swelling. As it progresses, the stiffness comes in. Now you are eroding all the cartilage away. So a bone and a bone are hard surfaces. They can't slide over each other because what was lubricating them is now gone. So the stiffness comes in. Then later on, they can also deform. You find someone whose knee was normal or was like straight, then it is kind of bent either towards the midline or away. So what are some of the factors that expose us to this wear and tear of the cartilage? One is age, because everyone is going to use their knee from their childhood up to elderly. So by the time you reach elderly, that joint space which you are using since childhood has to reduce. And we have seen that when we have reduction, we have a risk of arthritis. Two is weight. When you compare yourself with someone who doesn't have that too much weight, it means that too much weight you are putting on the knee, you are overworking the knee. In other words, you are putting that weight on the narrow or on the space. So the rate at which it will narrow will be faster compared to the other one who doesn't have that too much weight. Three is the activity. In your daily routine, you look at how much you use your knee, just like the sole of your shoe. The shoe that you put on more oftenly, its sole goes on reducing faster compared to the other one, which you don't use like so oftenly. Then fourth, it could be a deformity. Let's say we are having deformities in the knee that disturb the line of weight bearing. Whenever a line of weight bearing is shifted from where it's supposed to be to the other way, or to the other way that's not supposed to be, those structures to where it is shifted to are not adapted to do so. So you'll have a higher risk of narrowing that space faster in comparison to the other one who doesn't have that deformity. Then joint injuries. Of course, joint injuries directly will encroach on the articular surface, and that's how they can predispose you to that wear and tear. Then also, sometimes genetics, health status, sometimes you can have diseases that also involve joints, and so on and so forth. Then about the management, we shall merge it with the pathophysiology, maybe in another video, which we shall make a little later. Thank you.